Opposition leaders slamming the government's response to the COVID-19 pandemic, with some backlash coming from the Minister of Foreign Affairs and Public Service, and COVID-19 deaths in country continue to increase. Good evening, everyone. I'm Tyler Simonet with your Jcn News for this Monday, October 18th. It's great having you back with us. While COVID-19 numbers seem to be trending down, COVID-19 deaths continue to increase, and the official opposition contends that the government has failed to articulate and execute comprehensive public health measures. Former Prime Minister and opposition leader Dr. Hubert Minnis slamming the Progressive Liberal Party government's response to the COVID-19 pandemic. Dr. Minnis, in a statement on Sunday, accused the Davis-led administration of having a response to the COVID-19 pandemic that is uncaring and indifferent to the pain and suffering of those who are getting sick and their families. The Free National Movement leader contends that since coming to office, the PLP administration has led a disastrous, incompetent, and chaotic response to the pandemic. In a statement, Dr. Minnis says that the PLP promised that it had a plan and a way forward on the pandemic, and charges that tragically there is no plan as promised, with one of their first decisions being to relax the curfew. The statement noting that Dr. Minnis is questioning the government's strategy to deal with outbreaks throughout the Family Islands, the capacity for airlift if severe cases increase, and if the government is considering any measures or restrictions to address increasing number of deaths in country. This as there are reports of rising case numbers and deaths on a number of Family Islands, which have limited capacity to deal with severe cases due to limited oxygen supplies, no ventilators, and no intensive care units on our islands, except New Providence and Grand Bahama. The FNM leader questioning Prime Minister Philip Davis's failure to address the country on measures his administration will take to remedy a variety of matters related to the pandemic, noting that the former government sought to balance saving and protecting lives and livelihoods and quickly put in place comprehensive measures to limit outbreaks on the Family Islands. Dr. Minnis says the country awaits the government's strategy and plans on the management of the pandemic in the days and weeks ahead. After former Prime Minister Dr. Hubert Minnis blamed the government over its handling of the coronavirus pandemic and for the most recent spike in positive cases and deaths in the recent weeks, Progressive Liberal Party Chairman and Minister of Foreign Affairs and Public Service, Fred Mitchell, launched a scathing rebuttal of his own, chiding the former Prime Minister about his performance while in government. He describes Dr. Minnis as being politically dishonest.
So, if anyone is to blame for the current mess we are in with COVID, it is clearly Hubert Minnis and Renwick Wells and the FNM, and not Brave Davis or Michael Darville or the PLP. Dr. Minnis's attacks are politically dishonest, just a bunch of lies. The fact is he called a general election in the middle of the pandemic, 8 months before he had public rally after public rally. So Minnis and the FNM helped to spread COVID, and now we are in a spiral of death and sickness. But instead of asking for forgiveness, he's blaming the PLP.
Minister Mitchell used the timeline and incubation period for the coronavirus to trace a cause for the possible spike back to the Free National Movement and events that they hosted leading up to the elections. Mr. Mitchell ended his comments with a word of encouragement for the PLPs and Bahamians in general, who just want to see the COVID-19 pandemic handled wisely. But when it came to Dr. Minnis, he was not too kind, also pointing out the FNM's opposition to proper national health insurance.
And don't forget how he fought the PLP's national health insurance program, so our healthcare system is today in total collapse, a state of collapse. No, Dr. Minnis, it's not the PLP. It's your fault we have the death and destruction. Shut your damn mouth, hush your damn lies. To all PLPs anxious that these problems be fixed, I agree, time is going, but IMF, it's Minnis's fault, and we cannot fix in 4 weeks what Minnis did in 4.5 years. Think about this, folks. All will be well in time.
Mr. Mitchell made his comments on Monday after returning from Miami, Florida, following a meeting of foreign ministers for CARICOM discussing a wide range of topics, including Haiti, Venezuela, Nicaragua, and climate change, among other topics. The Ministry of Health and Wellness and its Minister, Dr. Michael Darville, leading implementation of new tools to fight COVID-19 cases here in the Bahamas. With COVID-19 cases seeing an uptick in the Family Islands, The government is now in the process of building a nationwide free testing program, which will begin as a pilot program in those family islands currently most at risk for community spread of the COVID virus. Health officials in a statement say over the past 3 weeks, Minister Darville and the members of his COVID-19 technical team have visited islands in the southern and central Bahamas to conduct an urgent assessment of the situation there. And the minister has dispatched COVID-19 surveillance and enforcement units to Inagua, North Eleuthera, and the Berry Islands with the intention to review COVID-19 cases, tighten surveillance protocols, and better support those who need to isolate and quarantine. The ministry will also begin distributing medical-grade masks on those islands currently experiencing COVID-19 clusters, and is also in the process of identifying resources to assist with the surveillance and enforcement of COVID-19 protocols, and will expand both public education and vaccinations on these islands. In a statement, the ministry says it has been clear for more than a year that widespread testing is an important tool that has been underutilized in our country's fight against the spread of the virus. Within the next few days, Minister Darville and his medical team will continue to visit family islands with identified clusters to further assess conditions and meet with local professionals and residents about the way forward. 3 females and 1 male, all residents of New Providence, are the latest victims of COVID-19. The Ministry of Health and Wellness releasing COVID figures for Friday, October 15th and Saturday, October 16th. On Friday, health officials say the victims between the ages of 38 and 88 died between September 28th and October 4th. These deaths added to 14 deaths confirmed by the ministry last Wednesday and 3 deaths that were reclassified as COVID-related last Monday, total deaths confirmed in 1 week. Total confirmed deaths in country as a result of COVID-19 now stand at 626. 59 deaths are currently under investigation. As for active COVID-19 cases in the Bahamas, that total tallies at 1,196, as the ministry confirmed a combined total of 49 new infections over the weekend, 28 on Friday and 24 on Saturday. New Providence leading with 37 new cases, Crooked Island 9, followed by Grand Bahama with 4 new cases, and the Berry Islands and Inagua with 1 case each. Total cases in country now at 21,978. 113 people are in hospital, 12 in the intensive care unit, 101 considered moderately ill. 62 people were reported recovered on Friday, no recoveries on Saturday. So far, 19,974 people have recovered from COVID-19. Former Health Minister Dr. Dwayne Sands commenting on the recent surge of COVID-19 deaths in country. In an interview with Jcn's news team, Dr. Sands was asked to comment on the public's current attitude towards COVID-19, which appears to be more nonchalant when compared to the start of the pandemic. Well, the former health minister says people are acting as if it's business as usual.
There is a level of resignation that we have just accepted that people are going to die. And as long as it ain't me, and as long as it ain't mine, well, that's just the cost of doing business. Now, that is a cold state to be in, to believe that a human life is no longer important enough to adjust public policy or public behavior. But it is business as usual, and literally the belief that COVID still exists is a question in the minds of many.
Dr. Sands says this attitude transcends both government administrations and contends that the country has dropped the ball when it comes to the handling of the COVID-19 pandemic. He added that vaccination numbers have also dropped due to inadequate public education campaigns and the country's vaccine supply running low. Dr. Sands also urges that we need to do more testing in country.
I think we need to set a minimum standard of tests that are done in country to maintain a positivity rate consistently below 5%. We have not been anywhere near a 5% positivity rate in more than a month. So if you look over the last 14 days, the average or so. And that positivity rate basically says that you're simply not testing enough to get a realistic sample of what's going on in the community.
Dr. Sands also added that stricter punitive measures should be put in place for those that don't follow COVID-19 mitigation protocols, such as mask wearing and social distancing. You're watching JCN News. Stay with us.